Good afternoon, everyone, and welcome. Thank you for joining us for today's Hot Topic in Healthcare presentation, Understanding Health and Informal Sector Gold Mining for Women in Kenya. My name is Carrie Ann, and I'm pleased to welcome you on behalf of graduate admissions at Bay Path University. Before we begin, I'd like to let everyone know that today's session is being recorded. We will also reserve time at the end of the presentation for questions and discussion, so please feel free to submit your questions throughout the session. Today, we're honored to be joined by Dr. Tara Rava Zolnikov, whose research over the past 15 years has focused on the intersection of environmental health, gender equity, and challenges faced by artisanal and small-scale gold mining communities around the world. Her work has helped advance our understanding of health impacts of mining, including mercury exposure, as well as the experience of women working within these communities. This presentation will explore important issues related to global health, women's health, social equity, while highlighting how research can help inform more equitable policies and practices. And then this is me. Hello, everyone. Thank you for joining us this afternoon. My name is, again, Carrie Ann Viennes, and I'm the Associate Director of Graduate Admissions here at Bay Path University. And then today's hot topic in healthcare presentation is Understanding Health and Informal Sector Gold Mining for Women in Kenya, as I've stated, and we're honored to welcome Dr. Tara Rava Zolnikov for our guest speaker. She is a professor, researcher, and humanitarian whose work focuses on culture, environment, and global health. She holds a PhD in developmental science and has authored more than 100 peer-reviewed publications examining the intersection of culture, health, and human experience around the world. Before we begin, I'd like to briefly orient everyone to the GoToWebinar platform. Throughout the presentation, please feel free again to submit your questions through the empty questions box. And for the best viewing experience, we encourage you to keep the presentation in full screen mode so you can easily follow along with both slides and the speaker's presentation. And at this time, please join me in welcoming Dr. Tara Rava Zolnikov.
Okay, welcome. This is a very fun lecture. It's on gold. So this study is something. It's a part of a larger project that is it's informal sector occupation. So it kind of blends all these different global health, occupational health, environmental health, and so it's like a very it's a big topic, and yet it feels very small because a lot of people don't really know about it. It's so I'm going to go over what artisanal small scale gold mining is, just within the country of Kenya, kind of globally as well. I'll talk about my methods, the results, and how it impacts people. Okay, so this is actually a picture that I took in the field. This is not an image that I stole. I had somebody try to sell me mercury. Okay, so the big thing about artisanal small scale gold mining, and why do we even care, is that it uses mercury to extract gold from ore. So it's like this rudimentary. I know you're thinking like, oh, when I was a kid, I used to gold pan too. And that's, you know, you had your pan and you were like shaking out the gold. Well, it's like not that dissimilar from that. But what they do is when they find the ore, they crush it and they use a sieve, and then they pour mercury in, which extracts the gold from the ore, so then they can get the gold and sell the gold. Obviously, I know you've probably heard of mercury. It's not good for people. It's not good for the environment. So there's a lot of people that are affected. We don't know. In these informal sectors, these are occupations that are not viewed in like a formal setting. We don't have a lot of hard numbers on them. We sort of approximate how many people are involved, but we believe probably 50 million people in maybe 70 countries. And interestingly enough, like a lot of these miners are women. So mercury, they get mercury. Mercury is in the black market. This is not something that is like easily accessible. In fact, I have been on interesting journeys. I've been conducting research on this small scale gold mining for over 15 years. So I've been in these like very interesting, precarious situations all over the world. I've been in Colombia, Ghana, Kenya, even Senegal, working on these issues. And it's really hard to find the mercury. And we had like a whole project in Ghana where we were trying to trace the trail, but it's actually quite similar to like drug dealing. And it's hard to find, the main person who is selling the top, the top part's very secretive, very hard to get, very illegal, and actually like quite expensive. So what mercury does is when it gets in the environment, so when they're sieving and they're pulling the ore from the gold, they're using like river water. They're still in the water, like, that vision of you gold panning. It's like, they're still in that water. They're using the mercury in the water. The mercury goes all over, goes downstream, goes in the soil. Animals are affected, like it's in the environment. Now, what happens is, like, if the people and the miners are using mercury, it's ignited. So there's smoke from the mercury. It's the worst form that you can get. If you have to be exposed to mercury, you want to eat it. So because it kind of just goes right through. But in the river, it can go into like different populations downstream, as you can imagine. And so it's like this huge issue that it's not just the mining communities that are affected, but all over the countries downstream of where they are gold mining, they are all affected as well. And so an interesting thing about this issue also with mercury poisoning is that it's actually very hard to detect. So people, when we interview them and when they talk about their dose, because on environmental issues and things like this, the exposures there's different levels. There's acute high dose, there's chronic low dose. And for some of these environmental exposures, you have different symptoms based off, obviously the exposure level. But when it's a chronic low dose, people are very quick to assume it's related to something else. Like, I'm depressed, I'm fatigued, I'm getting older. And so as you can see, the chronic low dose, it's like respiratory symptoms, dyspnea, cough, hemoptysis, impairment of pulmonary function, but they're like a lower level of symptoms and signs. In the past, and for a very long time, and probably currently, people thought they had malaria. Okay, so this was like an issue in and of itself, trying to be like, oh my God, you don't have malaria, like you don't have even a virus, you have mercury exposure. So it was like a health literacy movement to try to get like people up to speed on what was happening. As you could imagine, an acute high dose to mercury can be fatal, and that have permanent damage to your CNS. Chronic low to acute low dose, chronic low dose are the more pronounced, very kind of low key irritability, depression, vivid dreams, some coughing, fatigue, like these things that we kind of experience every day. Okay, so where are we in the world? So on this project in particular, I conducted it in Kenya. Kenya is a very interesting country to conduct this small artisanal gold mining scale research, because we don't have a lot of research on Kenya. And we have a ton of research in Ecuador, Brazil, Ghana, even Peru. We have research in other parts of Africa, but we do not have a lot in Kenya. Some of the kind of smaller populations are getting, they're just not as heavily researched, but it's also just really hard to get in. And the reason why I was kind of able to get into this population is because I have a nonprofit. I'm very integrated in the culture. I know a lot of people. That's one of the things that you would have to get into this area. So we're in the east of Africa, 56 million people, and where the research took place here was like in the western area. Okay, so this is like really a picture of a picture, so I apologize. But nationally, we think Kenya's gold sector is worth, in the veins of gold, about 5.3 billion. All of this is in a single county, which is in Western Kenya. So the yellow, like light yellow area up in that like sort of more closer to Sudan on the western side, there's gold there, and there's a little pocket on the other side. So where I was on that top segment, and that's where I conducted the research. Again, so the number 50 to 100 million people are involved with, now they think maybe like 20 million miners directly. It's all loose. We aren't really sure. They think in Kenya 250,000, which is, a kind of a lot of illegal gold miners, especially in just one like concentrated area of the country. They are typically low income, primarily uneducated, or have received little formal education. They do have high rates of accidents. The workers are exposed again to mercury. It's just, but in the case of Kenya, we're not sure exactly what's being reported. Women work in this field, as I mentioned before. And so they have an interesting story. So what I did was I wanted to see how women were in the industry, if there were gender role norms. I wanted to know their position. I wanted to know if they knew about mercury, if they did know, what they thought about it. And it's when you're out in the field, you sure do learn a lot. So that was the point of this study. Okay, so I'm a qualitative researcher, so I used a phenomenological study. I seek to understand the experience of the participants, but what I really like to say is I give my participants a voice. I give a voice to an issue through my people, and the reason why I love this and why I conduct a lot of this type of research is because you can get into very like rural, difficult populations and give a voice to an issue without it having like a high sample size. This particular issue, I probably could have gotten a lot of minors, and I probably could have created a mixed method study, but you never really know what you're gonna find out there. So this qualitative research is always a really good baseline study anyway. So this was the first study, one of the first in Kenya, not a lot of research, like I said. My questions are, I have to say, like they always start one way, like very structured, but then they end up going, like I listen to the people, I have it, all the translations are real time. And so it ends up moving into sometimes like different areas. This is like why I really love the semi-structured format, because I've learned a lot that when I kind of listen and I go with the conversation of the participants, like you really kind of get to the meat of like what's going on. But anyway, I always go in with just an interview just to see like if everyone's quiet, like I have questions, I can keep going. This study, we did use men as well to understand the study was about women, but we also included men. We had a really large sample size. We had the ages ranged 20 to 60. The education levels range from no education to tertiary, and that means high school. All women had children, and some were pregnant while they were mining. Okay, so I love to tell this story because this is like how I get into my areas. It takes me 3 days to get into my gold mining area in Kenya. Okay, so I fly into Nairobi on a flight. I take an 8-hour. I hire a tour, like a guide. You don't want to just go with a random person. You have to be very specific who you choose. But I went 8 hours to Kisumu. Now I'm in Western Kenya. From there, I have not only like my own driver, but I have the other professor that I'm working with, and we drive to this small, like one of the small towns called Bungoma. And from there, we pick up several of the nonprofit community health workers. So we have like a group, right? And then we drive in like 3 hours into the bush is what we call it. So the whole trip does take 3 days to get to. It's a lot of driving, very slow across the country. So what did I find? I found, which you probably are not surprised, but that the women who are miners have economic empowerment. So they say, here are just a couple quotes. I like to add direct quotes in so that you can see what the women are saying. With the mining, if you are lucky to find rich land, you could be rich in no time. Through the mining, I have been able to take care of my children, providing food, shelter, and also taking care of their hospital bills each time they are not well. Another participant said, we have been able to build houses and other properties from it. So you can see that the women are like earning income here from their job, which is not unexpected. There have been times when the women can't mine, and so as also expected, there are financial difficulties when they are not able to mine. Per the type of work that I do now, I will not get money to buy things because I do not earn that much from selling rice. I make about $4 a day. Also, through mining, I was able to get my children through education. Now they have all completed at least senior high school, but I would not be able to do this without mining. So the women are using their money to put their kids through school to really take care of their families. So when the women are at the mine sites, they have very difficult jobs. The sites are physically very exhausting. They're almost always in very hot areas. And while the women do work together, it's not an easy job. And so here's a couple quotes about that. We did what the men did, carrying loads among others. Another one said, I must say it is difficult to perform, so you need a bit of physical strength. Another participant said, I was carrying loads with the men, then I realized I wasn't strong enough to keep up with the men. We found gender inequality. The focus of the actual publication on this big research topic was gender inequality. And so, I have a lot of like broad results, but this was the most important one. We did what the men did, carrying loads among others, but then we realized we were being cheated by these men. Landowners do not allow women who are on their menstrual cycle on their sites because they believe by doing so, you distort activities on the land. Another participant said, at times on the sites, we are chased with canes or physically abused. Other times we are pushed in the pits. But upon all these harsh working environments, we think about our children and their future, so we keep going. There are gender role norms that exist. Here's some quotes from that. I carry dirt during menstrual periods and am restricted to processing activities. The processing is where they're exposed to mercury. Okay, so another participant said, some women rely on relationships with men in the mines to access better stones. So the stones and the quality of the stone is going to have more gold in it. So there are sexual relationships and transactional relationships involved so that the women can access these, like the ore that has more gold, supposedly. And then another one said they also receive stones as payment for labor, such as cleaning or cooking. So they're like, again, transactional. So here I talk about like the mercury, and I've been in huge focus groups with like 75 people. And I've asked like, what do you guys know about mercury? And interestingly enough, I would say that most participants have some health literacy about mercury. They know that it's not a good thing, but they are not really sure what it's doing. So they know they would like to avoid using it, but there is currently no better way to extract gold from ore. So it's like this. They all asked, "Is there what else?" Like I remember when I was sitting in front of them, and I was like, "Do you guys know what it is?" And they were like, "Yes." And they were like, "What else can we use beside it?" And I go, "Well, there's nothing as good as the mercury. You could, we have all these other different ways to extract the gold from ore, but it just is not, it's not pulling out as much gold. So when I tell them that, I'd be like, yes, you would be safer, but you would be making less money. They were like, no, I'm not going to do that then. So here's a couple quotes about that. Yes, we sit close to it. It flows in the water that we use on the sites, and we bathe with it. Another one is no one wears protective clothing. They just use their bare hands. They mix the dust with the mercury and shake it till it is well mixed. Then after they use their bare hands till it becomes solid, you cannot use socks or gloves because you might end up losing all your gold, because the amount of gold is like this, like the little tiny itty bitty tip of my pen. So if you're fumbling around and you're sieving and you have all these, it's like a pan and there's water, there's the rocks, and then there's the little mercury ball, and you're kind of like crushing that mercury ball into the gold to like pull it out. At the end, like you kind of dump the water, you mix it around, you dump the water, because I've actually done this. At the end, there is a tiny little bit of gold, and that is what they're going for every time. It's just like a tiny little amount. So what I found in my research was that we found there were economic benefits from the mine. They made more money there than they did, doing other household chores, selling rice, cleaning, cooking, etc. When not able to mine, the ability to pay for children's school fees, and they had struggle paying for their families, their kids. They found that mining, there was physically difficult jobs. There was inequality in that the men dictated what they could and could not do. Like women were not allowed to work on their menstrual cycles. They were not allowed. And they don't have discrete forms of like tampons or pads or anything. So it's like would be hard for them to disguise that. So it's like quite obvious. And then there again, we know there's mercury exposure. So we know that it's economically beneficial for the women, except that like most of the people who are making the most of the money are the men. And so those jobs are occupied by the men, and the women then fall on the side of like doing things that the men don't necessarily want to do, which is where they're not making as much money because there's not as much gold in these other things. So they do stone crushing, washing, panning, and they again are if these parts of the gold mining process are less remunerative. And then other research actually reveals that women are concentrated in the lowest paid aspects of small artisanal gold mining, which I'm sure is not surprising to hear. Despite working fewer hours and earning less than men, most women said that most of their household income is from gold mining. They make enough to continue doing it. So, and the reason why is they use their money to take care of their kids, to buy food and pay for school fees and healthcare fees. The women contribute towards combating poverty because they're taking care of their children. They spend their money on their children, food, housing. Even though they're in the worst parts of the job, it's all going towards their families. All of this comes at the cost of physical difficulties, gender inequality, and mercury exposure. So this is, again, a precarious situation that needs to have a more comprehensive intervention in place of, having women continue this. So what kinds of solutions are there? There is not a single solution. It's probably why, I've been working on the issue for 15 years. There our mercury removal technologies are not as good as mercury. And so that's a really hard sell in an area that is impoverished. If I say you're going to make $1 less, but you're going to be safer, would you take it? The answer is no. Minor education, they like and want more information regarding the hazards of mercury to health and the environment. They don't necessarily want it to where they would change it, but they're interested in like PPE, which is personal protective equipment. And so in front of all these big groups, they asked me like, well, what will help us? What can we wear? What can we use? How can we avoid it? And so, my answer really was like, do wear gloves. Do not breathe it in. Do try to don't put it in the water. Like, so there are like very small things that I was giving them, and they were like, okay. There are economic gains from various techniques and technologies. So like if we created a large operation where they could go, then they would be like turn in their ore and then have it be extracted and given back in a safe way. There are different processing centers. This is something that could be explored. I know they've done this in the past and it hasn't worked because ore is very heavy. So, these solutions, there's always like caveats. It would be nice to have support from the government through policy inclusion. And what I mean by that is these informal industries are not recognized. That's why they have pervasive issues that never go away. If we could formalize the sector, we could acknowledge it. They could get, go through trainings, have full health literacy of mercury, be able to curb back, use PPE, or safely use whatever as much as possible. As I said, there are other techniques. So if we could pay people like, oh, actually, if you use the processing center, you still make up that dollar, even though, we're going to use cyanide. Cyanide is actually a very good way to pull out mercury from ore. It's just scary for people because like one acute exposure is like death. So people are not super interested and happy to use cyanide. Other techniques are gravimetry, and that's like the force of gravity pulling apart the ore. Again, it doesn't extract as much gold, but it's just, if there was a way to pay for that, for them to come and use the center, maybe they pay for their regulatory paperwork, et cetera, and it all kind of evens out. But it's, it's an interesting discussion and something that we have not found a really great solution to. Again, finally, educational empowerment, it is important. They do want the information. They do like to have the information. Formalization of the sector, alternative solutions, to continue to like explore what we have, what we can use, etc. And then again, governmental support, not creating an informal illegal sector and knowing that 250,000 people in Kenya alone are working in it. That regulation is important to create change. We recognize the industry. There are always limitations in my translations, and that the population may not represent all women. I had a team, again, a big team out on this project. And so again, I thank them. And then this was the paper. This was in a very good journal, had an impact factor of 8. And it was published this year. And the title is Gender Role Norms and Livelihoods of Female Small-Scale Gold Miners in Kenya, a Qualitative Study. And I have published on this topic. So here are all of my other papers, and I'm happy to answer questions.
Great. Thank you so much, Dr. Zolnikov. Let's see. I'm going to move over to the questions box. I can see that people had already typed some in during the presentation, so I will read those out to you. The first being, what policy changes at the local, national, or international level do you believe would have the greatest positive impact on the health and economic well-being of women working in informal mining sector?
Well, they've already tried international. It's through the Minamata Convention. It did not work at all because you can't apply something in Ghana over to the field in Colombia. It just doesn't work because they're actually, we work very closely with the mining population in Ghana. We are very integrated. The government has tried something. They tried to put a ban on it. It didn't work. Um, you know, versus in Colombia, it's very illegal and it's very scary illegal. And so you can't apply the same policy, regulation, and standards across the board. So that did not work at all. It just didn't work. And so I would 100% say that they have to be national policies for them to have any sort of change in addressing the formalization of the informal sector.
Thank you. And then the next question is, let's see. Have there been any unintended consequences of efforts to formalize the artisanal mining sector, particularly for women?
We haven't really, no one's formalized it. What they tried to do was they tried to ban it in Ghana, and they had a military force go through the country to really try to like stave off the whole gold mining sector, because as you know, like Ghana is the Gold Coast. There's actually a ton of gold there, and it's a big gold mining. And so there it was. So what happened with that ban is that people were actually not only being exposed to mercury, but they were also being killed, and they all because they were continuing to mine because it was their livelihood. They didn't have an alternative occupation to go through and go like work towards. That was terrible. That was a terrible thing to be a part of. I was the first one that wrote a paper on the implications of that ban in Ghana, and the women were not able to pay for their kids' school fees. Like the women take care of their children, and in a lot of the like African settings, and so they were unable to pay for their children's school fees, their health. Some kids had to drop out of school. Some women resorted to prostitution. I heard terrible things, and it was, yeah, like it was even scarier because of that element, that military force. It was called the Vanguard, and the mercury tracing the mercury when I was in Ghana in the bush was very scary. It felt very unsafe where we were, because it actually, like, Kenyans, they know, like, yes, we have gold mining, it's an informal sector, we still do it, you know, it's like, it's not as it didn't have that weight on it. It was like, okay, you know what happens, like, it's, you know, it's not recognized, but we're not going to punish it, you know. This was very different. This was like we were secretly meeting with the like mercury dealers with sheets blocking so we couldn't see them, so that we could ask them questions on like the transactions. And it created almost like, it almost felt like this, like a drug dealer kind of like very scary system. So yeah, that was an unintended consequence that happened. That was a significant one.
Thank you. The last one I'm seeing is, what gaps in ASGM communities do you think most urgently need attention?
I think, I'm not sure if they're, I think the gap would be like, how can we get them the information, like I feel like the women are very open to health education. How can we get them the health education that they want? I feel like the gap is that like we want information and how can we give it to them in a digestible format. So when I was there with like these huge crowds of like focus groups, research in Kenya is very like interesting. You know, sometimes it's a focus group. It was supposed to be a private interview, but that's not going to happen. They all wanted to know what they could do to reduce their mercury exposure. I had pregnant women a lot in those groups, and they knew that what they were doing was not safe. And you know, I would say that they felt very trapped, and I didn't like that for them. They came to me really wanting to know like what could they do, and I was like, you could not use it. And they're like, but then I would not be able to take care of my child. And I'm like, you know, so that's one of my major things in, you know, this in my global health research is that in order to create the solution, you have to go live in the population to know what's really going on. And a lot of research that I know, and a lot of people, they're not willing to go like put their feet in the dirt. So when I listen to those people and all of the, you know, women, the only thing that I see is that I'm not going to take away their gold mining. That is not going to happen. I'm not going to take away their mercury because then they don't have a job. So it's more like, how can we manipulate this situation to where they still can work, but try to make it as safe as they can? It's not an easy, you know, it's just not an easy problem to have. So we give, and I told them to use as much PPE as possible.
Great. Thank you so much. This was a lot of fantastic information. On this next slide, we do have our contact information. If anyone's digesting this information and find they have more questions, please do feel free to reach out to us.
Yeah.
And thank you, Dr. Zolnikov, for sharing your expertise and insights with us today. Again, if you have any additional questions, please use the contact information or connect with us on social media. Thank you for joining us this afternoon. And again, this recording and slides will be shared soon, and we hope to see you at a future Hot Topic event. Thank you so much and have a wonderful day.
Thank you.